Most people think on Ozempic and Wegovy as just weight loss medications. They are not. They are heart medications hiding in plain sight. I'm Dr. Aida Matza, a cardiologist in Palm Beach. So here is what GLP-1 medications actually do for your heart health and why I'm prescribing them to patients who do not even need to lose weight. The cultural conversation about GLP-1 is missing the entire point. Everyone is talking about them for weight loss, but almost no one is talking about what the SELECT trial actually proved. These medications reduce your risk of dying from a heart attack. You don't need diabetes to benefit from a GLP-1. You need cardiovascular risks. You've heard the names Ozempic, Wegovy, Mounjaro, Zepbound. The entire conversation around these medications centers on weight loss. Celebrities are taking them. TikTok influencers reviewing them. Magazine covers ask whether they are too good to be true. But let's talk science. The SELECT trial enrolled 17,604 adult patients with overweight or obesity who didn't have diabetes, and semaglutide, which is a drug in Ozempic and Wegovy, reduced the risk of a heart attack or stroke or cardiovascular death by 20%. In large studies, GLP-1 medications lower the risk of non-fatal stroke, non-fatal heart attack, and cardiovascular death. They reduce major adverse cardiovascular events, what we call MACE. The benefit is stronger in people who already have heart disease, diabetes, obesity, or high cardiovascular risk. But here's the part that shocked. When even cardiologists, you don't need diabetes to see cardiovascular protection. Most patients I see associate these medications with weight loss only. They don't know their blood pressure, glucose, inflammation, and kidney function all improve on these medications. They don't know that the American Diabetes Association now formally recommends GLP-1 for patients with type 2 diabetes mellitus and cardiovascular risk because of proven benefit in reducing atherosclerotic cardiovascular events. If you have high cardiovascular risk, obesity, high blood pressure, high cholesterol, family history of heart disease, you need to ask your healthcare provider whether a GLP-1 medication could reduce your risk of heart attack and stroke. Don't wait until you're diabetic to have this conversation. The SELECT trial proved a benefit without diabetes. This is preventative cardiology, not vanity medicine. Which brings me to the second thing most people get wrong: who these medications are actually for. I prescribe these medications to patients who may not even be obese because I'm treating cardiovascular risk, not just body weight. The American Diabetes Association recommend using GLP-1 receptor agonists like liraglutide, semaglutide, dulaglutide in patients with type 2 diabetes and cardiovascular risk, not because they lower blood sugar, because they lower the risk of dying from a heart attack. In the HFPEF trial, semaglutide improved heart failure symptoms, physical limitations, exercise function, and weight in patients with obesity-related heart failure with preserved ejection fraction, which is HFpEF. That's a condition that is incredibly common in my patient population over 55-year-old and female. Most of them have never heard of it. HFpEF means your heart is stiff. It can't relax properly between beats. You get short of breath walking upstairs. You retain fluid. Your quality of life deteriorates. Many patients dismiss the symptoms as just getting older, but it's not aging, it's heart failure. And for years, we didn't have good treatments for it. This is not the only one case, but I have had patients with HFpEF, which after a significant weight loss and the right medications have recovered a very good quality of life, improving exercise tolerance and daily function. Many doctors see GLP-1 medications as diabetic drugs. Cardiologists see them as cardiovascular protection, and that difference matters Because if you have diagnosed heart failure, if you have high cholesterol and family history of coronary artery disease, you might be a candidate for a GLP-1 even if you don't need to lose 50 pounds. Now, before you think these medications are the answer to everything, let me tell you that they are not. GLP-1 medications are powerful tools, but they are not magic shots. They work best when combined with healthy eating, physical activity, good sleep, stress management, and regular medical care. That is not motivational speech fillers. That is biochemistry. Patients may experience side effects, especially at the beginning, like nausea, constipation, diarrhea, stomach discomfort. Most side effects improve over time, but you should always discuss concerns with your healthcare provider. These medications are not appropriate for everyone. They are contraindicated if you have a personal or family history of medullary thyroid carcinoma, or multiple endocrine neoplasia syndrome type 2. Treatment decisions should always be individualized. That means a real cardiologist who personally knows your case need to be making the decision, not a telemedicine prescription or spa prescription or meal running Facebook ad. The cardiovascular benefit comes from the combination of weight reduction, blood pressure improvement, glucose control, inflammation reduction, and direct effects on the heart and blood vessels. GLP-1 reduce markers like high-sensitivity C-reactive protein, which measure inflammation. They improve endothelial function. That's how well your blood vessels relax and contract. They reduce albuminuria, which predicts kidney disease and cardiovascular events. But if you stop the medication without maintaining lifestyle changes, you lose the benefit. Your appetite returns. Your blood pressure creeps up. The inflammation returns. GLP-1 do not replace a cardiologist. They require a cardiologist who knows you well enough your cardiac risk profile and can manage your care. I just want to be clear on one thing. I am not being paid by Big Pharma to talk about these medications. I'm just doing this as a teaching for my patients and anyone that is interested. Before starting GLP-1, make sure you have a cardiologist, not just an advertising from Google or Facebook. A cardiologist or a doctor that knows your case and can manage side effects and cardiovascular monitoring. Commit to the lifestyle fundamentals before you start. The medication amplifies what you are already doing. It doesn't replace it. Track your symptoms, track your blood pressure, and how you feel. Bring that data to every follow-up so your provider can adjust your treatment plan. Don't start a GLP-1 through a telemedicine prescription mill. You need real cardiovascular and primary care oversight. That is exactly how we practice medicine at CardioCare Palm Beach. If you are ready to look past the social media hype and discover what a comprehensive, forward-thinking approach to metabolic and heart health look like for you, let's connect. Visit us at cardiocarepalmbeach.com. Schedule your personalized cardiovascular consultation. Let's protect your heart together. Click the link below to visit our website to get started.